Live from the Western Mass News Studios, this is Better Western Mass.
Welcome back, everyone. Better Health Now on this Wednesday. In our studio, we have Dr. Maura Brennan, Chief of Geriatrics and Palliative Care at Bay State Medical Center, which, by the way, was just recognized as an age-friendly health system. Congratulations.
Well, thank you very much.
First in the country recognized as age-friendly. What does that mean? It's quite an honor, isn't it?
Thank you. Yes. The Institute for Healthcare Improvement and a number of other organizations dedicated to aging launched the Age-Friendly Health System initiative a number of months back, and Bay State is indeed the first that was able to satisfy the criteria for the recognition by IHI.
Is this something that you'd been working towards to get recognized?
Yes. We've probably been working over, depending on where you count from, a number of several years. Some of the programs actually preceded the launch of the age-friendly health system, but we were participating in their collaborative for about a year.
And it paid off. Now you're recognized for that hard work and effort. And not only the health system, but Springfield in general has been recognized as an age-friendly city.
Yeah, and that is amazing as well. We had a forum last month, in the middle of the month, and the city received age-friendly designation from AARP, and also received dementia-friendly recognition from the Mass Council on Aging. So Springfield is actually the only place in the country where it's age and dementia friendly and has an age-friendly health system. Another
first. I like to think we're always friendly to the aged, and goodness knows I'm getting older every year, but what does it mean in concrete terms? What does it mean to be an age-friendly city or age-friendly health system?
The age-friendly city is working towards improving amenities that make it better for older adults in the community, and the truth is that also makes it better for most of the other citizens as well. So already they've had some significant success in getting free Tuesdays for rides on the buses for older adults. They've corrected a number of the problems with street lamps throughout the city, and there'll be a number of other initiatives coming in the months to come as well. For the health system, it's an emphasis on tracking progress with what we call the 4 M's. The first one is what matters most. Right? That's the foundation, what people really care about.
Right.
Well, it might be good health. It might be spending more time with family. It might be not coming back to the hospital. It varies with the person. Then medications, mobility, keeping yourself functional and active, and mentation, right? How clearly are you thinking? Is there a problem with depression, avoiding confusion when people are admitted to the hospital? So those are kind of the core components of the age-friendly health system
And while
movement.
we still have a little time, I would be remiss not to mention we're getting hotter. It is July. How does that affect the elderly?
That's a great question, because any of us can get into trouble with heat exhaustion or heat stroke, but it's much easier for that to happen quickly with older adults because of changes in their kidneys and their skin. So it's important for people to make sure that they cool off when they can, to wear hats, light clothing, avoid going out at the hottest times of the day, and to be aware of the signs of dehydration and heat exhaustion.
And we always say if you have an elderly neighbor or elderly relatives, check in on them just to make sure they're doing okay.
That's key.
Excellent. Dr. Brennan, good to see you.
Thank you for having me.
Great information. We appreciate it.